Greetings and welcome to another weekly update from San Juan Regional Medical Center. I'm Jeff Bourgeois, President and CEO at San Juan Regional Medical Center, and it's a pleasure to be with you again this week. Just want to kick off with just some general reminders about San Juan Regional Medical Center, your locally owned community hospital. We know emergencies can happen at any time, whether it's a stroke, heart attack, accident, or injury. Our caregivers are here and ready to provide high quality, safe care. Our San Juan Health Partners clinics and specialty care clinics are open, offering in-person as well as telephone and video visits for your convenience. Please feel free to reach out to them should you need to schedule an appointment. Having a wide variety of options helps us ensure that you, our patients, are able to stay at home if needed while still receiving the high-quality healthcare services you deserve and have come to expect. Also, if you're in need of medical care services with any of our clinics, please call the clinic's main phone number to schedule your appointment. You can find those numbers on our website at sanjuanregional.com. Remember, especially if you are in need of emergent care, our Health Partners Urgent Care Center is open 7 days a week with extended hours with board-certified physicians. And as always, San Juan Regional Medical Center's emergency department is open 24/7, 365 to meet your emergent healthcare needs. Our elective, procedural, and diagnostic schedules are open and ready for appointments to be scheduled, so please feel free to reach out to your physician to schedule those as needed. And I also want to remind you of our social media platforms at Facebook, Instagram, also our website at sanjuanregional.com. You can find a wealth of information on these different sites, particularly if you look at our website at our health library, which includes health and wellness information and also including some healthy recipes. We encourage you to try those. Looking at what's going on in the state from a COVID circumstance statewide today, the R effective rate, or the growth rate, has now dipped below 1.0 on a statewide basis. As of the most recent report from the state, is now down to 0.9. That's great news, and it's indicative of the slowing down of the rate of spread of COVID-19 throughout our state. Our region in particular, Northwest region, is back down also. We're at 1.0, and I expect that by next week we'll continue to see a continued downward trend in that. Statewide, hospitalizations are also down. Back in mid-May, the peak was approaching 250. Today, statewide, they're down to 138. ICU capacity statewide, particularly among the 7 hub hospitals that coordinate ICU capacity, are also in good shape today with plenty of capacity, and we continue to coordinate with our partners for ICU needs. Looking at what's going on here at the hospital, today our total census is 111. If we looked just at our COVID floor, if you will, there's only 18 patients there. So that means 80+% of the patients in our hospital today are there for non-COVID related reasons. I don't think we've really stressed that point in previous weeks' updates about just how much capacity we have for non-COVID related work at the hospital and how many of our patients are actually in that category. This slide here shows that in a bit of a graphic format. The top blue line is our overall census on a day-to-day basis, and if you look down to the bottom, that purple line is the COVID census, and you can see again by looking at this graph that the vast majority of our patients in the hospital today, and really on any given day, are there for non-COVID related reasons. I want to share that with you so you can understand that we are able to care for COVID and non-COVID patients safely as hospitals across our country have adapted to this pandemic and made provisions to separate those different patient populations and keep both COVID and non-COVID patients safe. So just a quick summary. Statewide, the daily case count continues to decline, as does ours here in San Juan County, and more importantly, right here within the walls of San Juan Regional Medical Center. We are actually seeing our percent positive rate for the test we administer on a daily basis. We're now seeing that back to where it was just at the beginning of this pandemic. So we haven't seen our positive rates this low since the end of March. So we're encouraged by that trend, and thank you all, community, for helping us slow the spread of the disease. After a brief period of hospitalizations increasing in July, we now see them again trending down. As I mentioned, 138 hospitalizations statewide today, well below the peak that was approaching 250. That said, COVID-19 still has a significant presence in our country, in our state, and also here in San Juan County. And so we need to keep our guard up. Let's not be complacent. Let's do what we can to continue to drive down the rate of spread here. Wash your hands, social distance, and wear a mask when in public or in close quarters with others. Keep your distance 6 feet from others if at all times if possible. And we'll continue to see the trends improving that we've touched on here today. So thank you again for supporting San Juan Regional Medical Center. Hope you all have a blessed day and a better weekend. Thank you.